You're listening to the Health and Happiness Podcast with Travis Kemper and
Lauryn Maxwell. Each episode, we share easy to implement strategies to improve your health, happiness, and overall quality of life. The placebo effect is the single greatest indicator that your capacity to heal starts in your mind. Unknown. How's it going, Travis? What's been new in the, week, maybe? Nope, few days since I've talked to you?
It's going well. Julia has a friend staying with us since Wednesday.
Yay!
And my life has settled down a little bit now that football season is over and most of the dealing with the houses and stuff is done until we move. So,
well, that's exciting. Yeah. It's like the calm before the storm of moving.
Yeah, exactly. And I've had some really, really awesome patient experiences this week. So I am
nice.
I'm having a good time. How's life over in Flagstaff?
Life is good. It's warming up. It's like beautiful outside right now. Nice. And also this week I got to actually go see some of my babies in person for the first time in like a year and a half. Yeah, so call me Happy Lauryn because it was like the best thing ever. I got to like actually hold babies and like do therapy, and it was amazing. Like that's what I love about my job, and I got to do it. So happy girl this week.
Yeah, not sitting in front of a computer all day.
Mm-hmm. Yeah, I got to be outside treating kids. Like
that sounds awesome.
So good, so good. Yeah. So what are we going to talk about today, Travis?
Well, placebos and nocebos. And I have to tell you, doing the research on this has confirmed two things. One is my treatment style with my patients, and two is my hatred of medicines, even more. So, Lauryn, how about you define placebos and nocebos and tell us a little bit about them?
Yeah, like what the heck are they? So for anybody who doesn't know, a placebo, I think, is the one that's more commonly known, but it's a positive effect from a treatment with no therapeutic value. So I think a lot of people know them as like placebo pills, right? It's like a sugar pill, but it can be applied to things that are like more than pills. And a nocebo is just the opposite of that. So if a placebo is a positive effect, a nocebo is a negative effect. Basically what it's measuring is the power of your mind.
Yeah. And the mind is quite powerful, as we're going to find out, huh?
Yeah, it's pretty cool. So I think one of my main questions before we get into some of the research is how the heck does this work? Like, what is the mechanism behind it, right? Well, there was an article that I read that basically broke it down into 4 factors, but I think the one that makes really the most sense to me, like right off the bat, is it's your expectation and conditioning. Again, it's just really the power of the mind, and what you expect to happen tends to happen. I mean, we kind of talked about that in our last episode, right? Like with our positive affirmations. If you're saying like, I'm confident, which I've been saying all week, you become confident. You become what you say you are. That's your expectation. And it's very similar here. What I thought was particularly interesting, bless you.
Thanks.
What I thought was particularly interesting was that a lot of the effect sizes can be related to different things, such as like your relationship with your doctor. If it's a good relationship, there can be like a stronger effect for a placebo. It could also even be related to like the color of like the placebo pill. So I think I read that like orange or red or yellow was like, you would assume that's like a stimulant, whereas like green or blue would be a depressant. And then the size of the pill had a stronger effect. So like not a stronger effect, the size of the pill had an effect. So the bigger the pill, the bigger the effect. I just thought those were really interesting, but I think it's because of that conditioning of what like we assume a pill looks like or something.
Right. Based on, I don't know what it's based on, but
arbitrary things.
My vitamins should have a huge effect because they are a huge pill.
Right. See?
And they do have a huge effect on increasing the value of my urine. If you don't know anything about vitamins, they mostly are just peed out. Anything else you want to go into there?
I think that one other interesting thing was of the factors that it talks about. It's basically saying that placebos or nocebos can cause changes in your brain, and then there is a connection between the brain and the immune system. And of course, this can affect more than just your immune system, as we'll find out in some of these research studies. That sounded wrong. I'm sorry, I'm tired. As we'll find out in some of these research studies, but there is an actual connection called psychoneuroimmunology. I guess that's the study of, but that's the connection between the brain and the immune system, which pretty cool. Anyway,
that's a big word.
I know. I learned a new word.
Psychoneuroimmunology. Anyway, by the way, how are your positive affirmation placebos going for your sleep?
Oh, actually, I'm glad you brought that up. You always bring up such good questions. So I did tell myself I was going to sleep better this week, and I did sleep better. It wasn't great, but it was definitely an improvement from last week. So whereas last week I couldn't even like fall asleep, like I basically just like stayed in my bed for 8 hours and was like, what am I doing? This week I actually fell asleep. I didn't stay asleep for a lot of the night, at least for like the first 3, but last night I slept so good. I was only awake for like an hour and a half in the middle of the night, which like is a huge improvement. So I'm pretty excited.
Excelente. All right. So back to, the placebos. I have a favorite study ever, and this is it.
Tell me about it.
84 female room attendants working in 7 different hotels were measured on physiological health variables affected by exercise. In one group, they're split into 2 groups. One group was not told anything, and they just were part of the study. Mm-hmm. They just went about their day. The other group was told that the job that they do was good exercise and satisfies the Surgeon General's recommendations for an active lifestyle. So they measured a lot of different things. One very important thing is that the group that was told that they hit the exercise criteria that is recommended perceived themselves to be getting significantly more exercise than before the study. Also, in even more important things, they demonstrated a decrease in weight, a decrease in blood pressure, a decrease in body fat composition, a decrease in waist to hip ratio, and a decrease in BMI. So just being told that this group of 42 women had a significant decrease in all of these things, and the other group that wasn't told this had no decrease.
Which is wild. I mean, that's wild because they're doing the same amount of exercise. Yep. Like they're doing a physical job. But some of them actually saw differences, and it was because they were told it satisfied the Surgeon General's recommendations for an active lifestyle. That's wild.
Yeah, that is my favorite study of all time.
And apparently you told me about this multiple times in grad school, and I didn't remember it. So sorry. I'm usually much better at remembering things than that.
Yeah, I told you. I brought it up like twice a week for 3 years.
Oops. It's just fascinating. Kidding. I'll remember. Wait, just kidding? No! I apologized in front of all these people who are listening for something that I didn't even do. Placebo. Nocebo.
Anyway, so chronic low back pain, major cost to the healthcare system. Probably number 2, I would guess. And if you're working into the economy, it's definitely number 2 behind obesity. Randomized control trial, another study, open label placebo versus treatment as usual. So an open label placebo, Lauryn.
I was just going to ask you.
Oh, really? Okay. Yes. So an open label placebo is I tell you it's a placebo.
That's what I thought, but I just wanted
So
to make sure.
you know you're not getting real treatment. So they
Oh,
measured pain severity in these two groups, and the treatment as usual group demonstrated less pain reduction compared to the open label placebo group. So they knew it was a placebo and had
whoa!
less pain. Yeah,
Which is,
crazy. So that
yeah,
is a new thing that they are studying. That was the 2016 study. This is a new thing that
okay.
they're studying, the open label placebos, because they thought if you tell people a placebo, common sense tells you if I tell you that it's a placebo, it's not
Right.
going to make a damn bit of difference because you're like, hey, you're giving me a sugar pill, dude.
Well, right. Yeah. I mean, that was like the magic of the placebo pill is you thought it was the actual pill. But if you can tell somebody that it's a placebo and they're still getting the effects of it, even though they know it's a placebo, that
Yeah.
kind of blows my mind like
Yeah.
a lot.
Well, what we're about to explore is how beneficial really are the medicines that we're told work versus a sugar pill. So I'm going to let you go into this next one, the systematic review,
Yeah.
meta-analyses.
So again, systematic review and meta-analysis is like the cream of the crop of research. And basically when you read them, they usually don't conclude anything because they cover like all the studies. So when you find one that concludes something, it means that most of the articles that they found concluded the same thing. So this systematic review meta-analysis found that treatment and placebo effects were not different in 22 out of 28 predefined analysis. So, in simpler terms, placebo effects did the exact same thing as the treatment in 22 out of 28 groups.
So in that same systematic review of the 6 subgroups that did have differences between the treatment effect and the placebo effect, 5 of them had the treatment effect more had a better effect in what they were studying than the placebo, and one of them had a placebo effect that was more significant than the actual treatment, which goes back to the low back pain.
Yeah, which is just like wild.
Yeah. So there was another one. And we're gonna quickly summarize some of these because it's a
There's,
lot.
yeah, and there's just so many. Like there's research article and study after study after study.
Yeah.
That,
So nocebos. So just a couple studies on nocebos to really quick summarize. 50 low back patients, 25 were told that a flexibility test might increase their pain, and that group reported significantly higher pain than the control group that did the exact same test, but they were not told that it might increase pain. So again, nocebo is a negative effect.
mm-hmm.
A finasteride experiment, which is a drug that's a treatment for prostate disease. Half of the study was told that the drug could cause erectile dysfunction, while the control group was not told that. 15% of the control group reported erectile dysfunction, and 44% of the experiment group that was told it could cause erectile dysfunction um, experienced erectile dysfunction.
Yeah.
Crazy.
Yeah.
And then there was the 29-year-old who tried to OD on what he thought were antidepressants, but were really placebo pills. So they were a sugar pill.
Yeah.
And this is how strong this stuff can be. Now, this is a case study, so this is not huge level of evidence, but also it's not hard to imagine. We talked about me getting sick after telling everybody that I,
Right.
wasn't feeling well last week. So This kid took, I think, 26 of the placebo pills, so just sugar pills, and experienced hypotension, which is a decreased blood pressure that required IV fluids to maintain an adequate blood pressure until he was told it was placebo pills.
And then everything went back to
And
normal.
then everything went back to normal because he no longer believed that they should kill him.
I feel like everybody should take a collective sigh after that. The power of the mind and expectation and like what we believe is so powerful. I mean, like, even as a kid, I knew that, because here's a fun story to come off of that really like serious one. I remember giving my brother a glass of apple juice, and I told him it was tea. And he hated tea. So I gave it to him and told him it was tea. And I was just like, just try it. It's like a really good tea. And then he tried it and he like spit it out. And he was like, this is nasty. And then I
And
was
he
like,
loves apple juice.
he loves apple juice. And then I was like, it's apple juice. And then he was like, what? No, it's not. And he tasted it again. And he was like, oh.
That's funny. I hope he's listening.
I hope he's listening too. That was, yeah. Apparently, I could be a little bit of a brat as a younger sister, but it was funny.
That is funny.
Yeah.
So there's also this thing that medical students get when going through medical school called
Medstudent.
Medstudent. So 70 to 80% of medical students complain of symptoms related to the diseases they are studying. So some of them diagnose themselves with certain diseases, but basically just studying the diseases that like, oh, do I have that? Do I have that? Do I have that? And I think we experienced a little bit of that in PT school. Luckily, we didn't do too many diseases.
Yeah, I was going to say, I can't remember what I was convinced that I had, but I remember being convinced like there was one thing that I was like, oh, I have this. It clearly wasn't that, because I don't even remember. But yeah, I think it's just like, again, it's just you're studying something and then you're like comparing it, and then you have these expectations of like, oh, my symptoms match up with that. Oh, then I have this. And
right, which isn't quite a nocebo or a placebo, but it is the power of the mind.
It's the power of the mind.
Totally making you have these symptoms.
Yeah.
Yeah, so there's that. Oh, I forgot one. Darn it. I had read a study like a year ago about cancer treatments.
Uh-huh.
And the majority of the side effects being nocebos. So, you know how, like, what's the cancer treatment that for some reason is
chemo?
Slipping my brain. Thank you. Chemo. You know how people vomit a lot?
Yeah.
Like 85% of that, I think, in this study was decided to be from just nocebo effect, because everybody tells you that you're going to vomit.
Whoa.
Yeah.
Whoa.
Yeah, crazy stuff. So, like I said, reading these studies made me less confident in medicine than I already was, because I was already a pretty big skeptic.
Yeah. But yeah, and I wanted to bring up, sorry, you said something that I just want to expand on, because I know what you mean by it, but I want you to expand on it for the people listening. You were saying that it confirmed your treatment style. So what do you mean by that?
Yeah. I was going to bring that up here in a minute. So there is, with placebos and nocebos, there are ethical questions that have been even addressed by the American Medical Association and things like that. So a placebo may only be used if the patient is informed of and agrees to its use. Nocebos have medical providers obviously questioning whether they should tell patients about the side effects, knowing that a large number of them are going to have these negative side effects if they tell them about the side effects, but they have to tell them about the side effects because it has to be informed consent. Otherwise they can get sued. Mm-hmm. And I think the sly way they do these things is they slip you the packet of information. They don't tell you the side effects outright. Like they don't say, "Hey, Lauryn, this might cause you to puke." And
yeah, or like if you're picking up a prescription at, I don't know, wherever you pick up a pharmacy. Sorry, brain. they'll like ask you if you want to consult with the
Pharmacist.
thank you. They'll ask you if you want to consult with the pharmacist, and like most of the time I always say no, but I think that's like when they would tell you, all right, here's some of the side effects, you know what I mean? Whereas like if you don't consult with a pharmacist, they're just like, here you go.
Right. So one of the questions that the AMA asks is, how do you still have the effect of the placebo if the patient knows about it? And that goes to that, what the heck was it called?
Yeah, the open label
Open
placebo.
label. Thank you.
Yeah.
We
Which
were both
apparently
struggling with words.
I'm sorry.
Yeah, so there's the open label placebo effect that they're starting to study, which says that we still get the placebo effect even if we know it's a placebo effect.
Yeah.
So I said that it confirms my treatment style because for years, basically since day one of internships, I've been telling anybody that says they're struggling with being a physical therapist, I'm just like, be the placebo. Like the number one thing you can do is you have to be the patient's placebo. Because if you have a good relationship, which there's lots of research on how important the research or the relationship between provider and patient is, but if you have a good relationship with a patient and you can convince them that you believe that they're going to get better and you've seen other people get better, it can be extremely effective. And I use it all the time on every patient.
Yeah.
So yeah, that's what I was saying when I said that it confirms my treatment style. I'm going to continue to try and be the placebo. And for my purposes as a physical therapist, I don't know that the informed consent thing is really a thing, because everything I'm giving you is like, there are actually positive benefits. It's just, if you believe there are positive benefits to the exercises we're doing, there's more positive benefits. So
right. I feel like the consent applies more to like medication.
Yeah.
But with what you were saying, Trav, it doesn't even matter if they like, even if you were specifically to ask them, do you want to take a placebo for this? And they said yes. Apparently that still gives you some effect. So
yeah,
I learned a lot, I feel like, during this.
yeah. Yeah. Gosh, I'm trying to think of some sort of challenge that we can do. And maybe it's just believe that what you're doing is going to work no matter what you're going for in life.
Positive affirmations. I don't know.
Yeah.
It's like the same challenge.
Kind of.
Similar.
Kind of. Yeah. Just try and convince yourself that what you're going to do is going to work. So if you're exercising to lose weight, or if you're eating better to lose weight,
believe
just
that
believe that it's going to work.
Yeah.
And then it'll work better. Anyway, well, this was fun.
This was fun.
You have anything else to add?
I don't think so. Thank you for a very interesting conversation. Nice choice and topic.
Awesome. Well, thank you everybody for listening again, and we will see you again next week. Please send us a message if you liked the interview episode that we did the other week with Chad. If you liked that type of thing thrown in every now and then, or if you would recommend doing more interviews, or however you want to word it, that would be great. Just great feedback for us so we can keep bringing you better content. Thanks, everybody. Bye.
Bye.
Thank you for taking the time out of your busy day to listen to this episode of the Health and Happiness Podcast. We hope you enjoyed the episode and are getting benefits from our content.
If your life is improving in part due to the information in this podcast, we would greatly appreciate you sharing the episode with your family and friends on social media and leaving us a review so we can continue to reach more people and improve the health and happiness of the community at large.
Thanks again, and we will see you next week for another episode of the Health and Happiness Podcast.